Okay, I'm here again today with Dr. Sieg. Dr. Sieg, nice to see you again.
Nice to see you again, Rosie.
People may be sitting at home and finally looking at how they can improve themselves and their bodies. Let's talk first and foremost about something that might be very painful for some people, osteoarthritis. What exactly is it? How does it work?
In general, people have joint pain and they think osteoarthritis is when the cartilage, which is the squishy stuff at the end of the bone, is worn away and they have bone-on-bone arthritis. The entire joint is like its own machine. And so the soft, squishy cartilage at the end of the bone gets its nutrition from the bone itself. And that's what the subchondral bone is. The subchondral bone is the bone underneath the joint, underneath that soft cartilage, providing that nutrition for the cartilage itself. As it starts to break down, the whole process breaks down, the bone and the cartilage, and eventually that leads to pain and then bone-on-bone arthritis.
I didn't know any of that. Thank you for the anatomy lesson and soft squishy stuff for cartilage. You are a man who speaks to the people, my friend. Let's talk about how osteoarthritis can be treated. There are a couple of different ways, right?
So in general, people are going to refrain from activities that cause it pain, such as high impact activities for a while. They'll take some anti-inflammatories, maybe use a brace for treatment, ice, heat, some physical therapy for stretching and strengthening. The only surgery that really helps with true arthritis is a total joint replacement.
Obviously, a total joint replacement is going to be major surgery, right? So there's something that high energy shockwave therapy can do, and it's specifically called OsteoWave. So how can that help people who have osteoarthritis?
OsteoWave is a form of shockwave therapy. And so it's a non-invasive treatment before surgery. It gives us another option to help the patient. So what it does is the shock waves are treating that subchondral bone that we've been talking about. They trick your body into thinking there's injury, and it increases the blood flow to that area and thus remodels and regenerates the bone. And then that bone can support that soft cartilage at the end of the bone. And what that does for the patient is it decreases their pain, restores their function, and it can give them lasting relief.
Goes to show that the human body is an incredible thing and that y'all are so brilliant for coming up with ways to help the body heal itself. Let's talk just a little bit more about high energy shockwave therapy. How useful is it? Is there sort of lasting relief that you'll get for it? Does the FDA approve it? That sort of thing.
It's approved by the FDA. It can give people lasting relief. It causes your body to stimulate healing so your body heals itself. So if you can heal yourself, then you don't just treat the pain, you're treating the underlying cause for the pain. And that's what our aim is.
That is incredible. And so you said this comes before surgery. So is it possible that if you use this shockwave therapy, you may not actually end up needing the sort of joint or hip surgery that you would be looking at?
Yes, that's true.
Man, well, saving lots of money and saving time in the operating room as well. That's absolutely incredible. Dr. Sieg, we really appreciate your time this morning. Thank you so much.
Thank you.
Sonex Orthopedics is the sound alternative to surgery. They're located off Jollyville Road. For more information, you can call the number on your screen or visit them online, sonexortho.com.